In this training, we're going to go through the typical charting process for a provider seeing an established patient. So right now we're looking at our scheduler screen and we're going to see Ann Smith. We're going to click on her appointment and check her in as arrived. And that's going to change the corner for appointment to red, indicating that she's arrived, but there's no charting done on her yet. So we'll click directly on her name, and that will bring us into her treatment dashboard. To the left, we have treatment note template options for your clinic. These you can modify through the clinic menu under clinic setup in your treatment note settings. There's a training you can review on that with your clinic setup, available under our resource center in the support menu. So for treatment notes, we have a variety of different chiropractic daily treatment notes. My personal favorite is the detailed note, so we're going to look at this one. But all of our notes follow the same principles in that they have a ditto effect, meaning anything that you put in previously for the patient is going to carry forward, and your job now is just to make changes from visit to visit to make the note truthful and accurate for the current date of service. I like the detailed note because you get a lot of different subjective charting options here. So it goes all the way from chief complaint through a sixth complaint. Along with all of our treatment notes, only what you input is going to follow up into the output of the note. So meaning if the patient really only has one complaint, then it's not going to show in the output that you've intentionally skipped the second through sixth complaints. So as I go down through the note here into objective charting, I can drop this down to light up, indicating a spasm at that area. All right, and again, anything that I don't fill out will be just omitted. And so if I don't choose to fill out hypomobile joint function, and instead I'm going to document that information in my subluxation strip at the bottom, I can leave that blank. So in the range of motion section, you can either put a visual or a measured range. You can also put decreased. The output of the note will just show exactly what you put in that text box in approximation to the information prior to the text. So ATLs, if I click here, it's going to provide me some options for clicking. Patient is about the same since their last visit. They tolerated the treatment well and without incident. Diagnostic codes on this area here, in my opinion, you can skip these because you're just going to put them in on the fee slip in the next page. If you'd like to specify ordering from here, which is not required, you can do so. Otherwise, that'll just be done in the billing. Put in our subluxation areas that were adjusted, our goals, assessment, plan, and then anything additional I'd like. If you are using an iPad or an iPhone, you can use the speech to text function for any kind of a text box in our system. And then based on your login, it's going to grab your provider information automatically. So we'll go ahead and save, and that's going to bring us to our fee slip. A couple important things to note here in a fee slip. For claim assembly, this is communicating how you'd like this claim to be assembled. If you'd like this claim to automatically go to ClinicDr to assemble the claim, that is an additional service that we offer. You can click this one. Otherwise, this middle box will result in no automatic claim being created at all. So if you click this, when you save, no claim will be created. This bottom box is the default box in our system, and this box will automatically create a claim based on your procedural information that you put in your fee slip, and then that claim will be automatically delivered to your pending claims folder. So we have some diagnostic information that's dittoed forward, but no procedural information. So if we'd like, we can expand and add an additional diagnostic information from here. And then we can expand and add our procedural information. We also have a patient certification. If you'd like the patient to sign to certify that they received the services listed there above, you can expand that and have the patient sign if you have a touchscreen. And then when you save, it'll be routed back to the calendar, and you'll receive a confirmation that that claim in the fee slip has been successfully saved. If we go back into that patient's file, if we need to resume the note or any edits need to be made, I'll go into the Doc Edits widget on the patient's treatment dashboard, and this is where I can resume the note or make any modifications as needed to the fee slip. So if I remember the patient had given a pain rating, for example, I can add that in, and then I can go to the bottom and save. So we have several other daily treatment note options for chiropractic. Detail just happens to be my favorite. You can click through the other treatment note options to see which one would work best for your visit. If you have any questions, contact your clinic doctor or account manager, and they'd be happy to guide you through the different options.